people who I see, they've been suffering for years, and they see doctors for mystery illnesses. For the average healthy person, you can give them herbs and supplements and they'll feel better. But some of these patients, they're just so depleted, they need a little more direct approach, and this is one of the ways to do it. And also in the chronic aging population, they need some things to de-age them. These are safe. Actually, some of them are naturally occurring too. It's a great way to get the body to fix itself here.
So our guest today, Dr. Clement Lee, he is a licensed naturopathic medical doctor and the founder of Optimal Health and Wellness, a comprehensive care clinic in Pasadena, California. That's in Los Angeles. And he created his integrative wellness approach to offer the best care possible for his patients. And so after obtaining his Bachelor's of Sciences in Biological Sciences from the University of California, Irvine, he continued his passion for restoring health naturally to Tempe, Arizona, where he received his doctorate of naturopathic medicine from Southwest College of Naturopathic Medicine in 2009. And Dr. Lee uses a broad range of modalities such as advanced lab diagnostics, oral and IV nutrition, lifestyle modification, regenerative injections, ozone therapy, bioidentical hormone replacement, peptide therapy, herbal medicine, energetic healing, and more to support all aspects of care from chronic illness, infections, autoimmune, general wellness, optimized performance, longevity, and beyond. Dr. Lee is an expert in regenerative medicine and injection therapies, as well as treating chronic illness, including Lyme, mold, parasites, hidden infections, environmental toxicities, and more. And Dr. Lee has even been an early adopter of various advanced IV therapy techniques, such as vitamins, botanicals, peptides, ozone, IV laser, and photodynamic therapy. And Dr. Lee is constantly innovating, combining and adapting with the latest advancements in healthcare, chronic illness, anti-aging, longevity, regenerative medicine, and integrative care modalities. And even the healthiest of individuals still may need evaluation and treatment of some of the underlying issues to maintain their dynamic health for the long run. So you can learn more about Dr. Lee's work at opthealthwellness.com. And so I know you guys watching the show, you're very, very much interested in anti-aging and detoxification, or even how your health issues are being caused by toxins, chemicals, and heavy metals. And I'm so thrilled to announce a new docuseries that I produced called theheavymovie.com. It's called Heavy, and it's essentially how heavy metals and chemicals are causing a lot of our health epidemics like obesity, diabetes, chronic fatigue, digestive issues, hormone imbalance, sex, stress, and thyroid hormones, and even aging. It's all totally free to watch. We've got 7 episodes that are free to watch that you can go check out starting February 15th, 2024. Just go to theheavymovie.com. We have 107 different experts that contributed to this event. It's really been a labor of love and a culmination of many years of wanting to do this, to really get to the heart of not just me talking about this, but other experts as well, talking about how toxins are causing so many health issues. Even like, lead is causing 17% of all cause mortality. That was a quote from Dr. Joe Pizzorno. And we have lots of other just really fascinating interviews from Chris Kresser, from Dr. Chris Shea, Dr. Mercola, and so many other experts at the top of their game, really laying out how toxins are causing so many health issues. And so go check it out, theheavymovie.com. And now a word from one of our sponsors. So imagine a world where we don't actually fight cancer. We just tell our bodies to stop growing it. Sounds groundbreaking, right? Dr. Dana Flavin, who's a world-renowned cancer specialist for over 40 years, warns we are swimming in toxins. They're in our daily products, our food, water, and air. The real danger? These toxins signal our body to grow cancer. That's why I urge you to join Dr. Flavin and Nathan Crean, an award-winning health researcher, in an eye-opening web class. They'll reveal the 9 key toxins that could be triggering cancer in your body, and most importantly, how to eliminate them. Don't just fight cancer, go right to its root cause. So join me by going to conqueringcancer.com/Wendy Myers, Myers, now to register for this free web class. It's so important. Again, that's conqueringcancer.com/Wendy Myers. Make the change today. Clement, thanks so much for joining the show.
Thank you for having me, Wendy.
Yeah, so I visited you in your clinic in Pasadena, California. I was desperate because I couldn't stop pulling muscles, and it was
Yeah.
making me insane, and it was preventing my workouts. And I had a shoulder injury that I'd had for a few months, and I just was beyond me what was going on. So I came to you in desperation for peptide therapy, and it was unbelievable. I had such a fantastic experience, and I have not had a pulled muscle since I started taking some of the peptides that you recommended, and it's just been a total game changer. And I didn't know what was going on in my body, but all I know is the peptides fix what was going on with me. So I wanted to do a show with you about peptides. But first, why don't you tell us a little bit about yourself and your practice and how you got so into peptides and advising about them in your practice?
Great. Yeah, thanks for letting me chat about this. So I'm Dr. Clement Lee. I'm a naturopathic doctor. I've been in practice since 2009, really originally into regenerative medicine, starting with prolotherapy. So my passion was in just helping people heal their joints specifically. But just being in this realm of medicine as a naturopathic doctor, people came to me for all sorts of issues. So from your general like high cholesterol, blood sugar, lifestyle things to more chronic things like Lyme, mold, and autoimmune diseases, and even cancer. So along this journey, started reaching into my pocket of learning these different regenerative therapies, including peptides. And I think I started peptides around 2014-ish or so, as just a different way of enhancing the body's healing processes. So prior to that, you had your vitamins, supplements, herbs, amino acids, all those different nutrients, which are good, to help the body heal. They're just more like chemical substrates or cofactors for supporting what the body's engine's supposed to be using. But the peptides are a little bit more specific in that they are more like coding to tell the body what to do. So they're more specific instructions telling the cells to start, in their own pathways of healing. So the body actually generates the peptides on their own. They actually make some of the peptides on their own. So they're all pretty much naturally occurring. But when you're in a pinch and you have, injured tissues that don't respond to your normal day-to-day, attempts to healing, having more of these peptides thrown into the system can kind of supercharge your body to start healing. So, first, the most common peptides people might have heard of, if you're familiar with peptide therapy, would be BPC. BPC stands for body protection compound, and this is what we use on you, Wendy. I mean, this is a
Yeah.
helpful tool. And what it typically does is it helps with connective tissue repair. So it's naturally produced in your gastric secretions, helps repair your stomach lining from all the stomach acid you got going on. But on the other ends, it also helps with your tendons, ligaments, and connective tissue integrity. So if you have, a muscle strain, sprain, or tendon ligament, injury, including tears and micro tears, it facilitates the body to start in that regeneration process. So then you can get the body to maintain tissue integrity, and that helps you resist, all the day-to-day wear and tears. Plus, if you have any chronic injuries that just haven't healed, it finally gets a chance to start healing. So that's kind of how we started. And then in the future, now there's these immune supporting peptides, there's these anti-aging peptides, and we'll chat about later, but these peptide bioregulators, which are even more fascinating ways. But yeah, we just started like introducing just more direct ways of getting the body to heal itself.
So what is the difference between, say, taking protein powder, which is a lot of people do to add proteins to their body, versus taking a peptide like the BPC 157?
The protein powder, typically they're amino acids, but they're not lined up in any order. So they're just the blank amino acids, which is like alphabet soup here. You're trying to spell a word or a sentence and you don't have it lined up, the body doesn't know what it needs to do. Versus the peptides, they're actually ordered in a certain sequence, so that it has really more specific instructions of what to do. So in that case, if you have those instructions, then the cells can know what they need to do. So if you don't have any amino acids, your body will fall apart. I mean, we need protein. But again, if it doesn't have the instructions, it doesn't know what to do with it. So it ends up becoming just relying on the body's own current processing at the moment in time.
Yeah, I couldn't figure out what's going on with me, why I kept pulling muscles. It's not like I'm some super athlete that's, you know, straining my body all the time. But I thought I needed some protein powder, or maybe it was some collagen,
Yeah,
but nothing worked at all.
yeah,
And I knew I don't have digestive issues. It's not a lack of
mhm,
absorption. But yeah, the
yeah.
BPC immediately, never have had a pulled muscle since. My neck healed after 4 months of it being strained. It was just really, I was really shocked at how quickly it worked.
Yeah, no, it's amazing stuff. I mean, that's kind of where the downside with our body, especially with the connective tissue issues, is unfortunately when you get older, you run into those issues, but also just the attachment points of the tendons and ligaments, they don't have direct blood supply. So if they get injured, they strain, sprain, people who sprain their ankles after they heal, it's never 100%, or rarely it is. So the addition of peptides really gets the body to be able to reach that 100% mark, and then you don't have to think about it. So once it's nice and strong again, you can resist gravity and all your training and allow it to stay healthy.
Yeah, so the BPC 157. So how do you get that? How is it administered? Like for me, I'm doing an injection, but you can also take it orally, correct?
Correct. Yes. So the BPC peptide, there's gastric stable forms, which then means that they can bypass your stomach acid, not to get degraded. So that's kind of where like some of the peptides before the BPC, there's other peptides that would be degraded by your stomach acid, so they wouldn't be very effective, which is why most of them at the time were injectable. So BPC in itself can be administered via oral and or injectable forms because of its stability. Um, there are a handful of other peptides that are like that too, but yeah, going back to your answer question, is the BPC can be available both in the oral and injectable forms. Personally, what I've seen is they do nearly about the same. Some people who have gastrointestinal issues, oral makes a better sense because it's going to have its impact there first. If you've got a leaky gut, for example, it can actually start helping to heal the leaky gut, then also help heal other of your more structural issues. Some people want it to get more directly, and then I feel like it could be a little bit placebo effect. If you inject it locally where you have the problem area, you feel like it's going to work better. But I've seen it work both ways. So orally or injectable, I give the patients a preference. Financially, the oral one is technically cheaper than the injectable ones, but I mean, they can be administered both ways.
Well, I think that BPC 157 can really hold a lot of hope and promise for people with leaky gut. There are so many people with leaky gut. It's such a difficult thing to address with typical supplements, besides maybe colostrum. But a lot of people just aren't made aware of that as an option, or don't even know they have leaky gut. But talk about colostrum and how that can be great to, aid and give your body some building blocks while you're taking peptides.
Colostrum has multiple other effects too. So it has some of the immune peptides and growth hormone releasing peptides, as well as just good old fashioned collagen in there too. So it has multiple effects on really defending your gut lining, repair the gut lining. At the same time, it's a food that feeds a lot of your intestinal bacteria too. So it's kind of nature's magic food here. And that's why the mothers create it and then the first feeding of their breast milk. So it kind of develops the infant's immune system too.
Yeah, and what's the brand that you like of colostrum?
I use Sovereign Labs. So I've been using them for probably nearly 10 years now. A lot of great things out of it. And people can heal their leaky gut. And not to mention, if your gut is healthy, your skin gets healthy too. So you have a lot of the aesthetic effects of it. And then not to mention also your ligament connective tissue integrity too.
Yes, and so let's talk about some other peptides that you really like that you typically will recommend to your patients.
So I like using the thymosin alpha and thymosin beta peptides. So those are immune regulating peptides. So when we're dealing with chronic illnesses, sometimes the immune system gets dysfunctional due to stress or toxins, which is your favorite topic, and then and also hidden infections that just overwhelm the immune system's capacity to really help you fight. So then people can develop either autoimmune diseases or just immune exhaustion. So these thymus peptides they're very interesting at really rebuilding the immune system and restoring its function. So people who are in an autoimmune state or even just depressed immune system state, they can be very helpful at just restoring their functions back. So there's, I mean, the most common ones are thymosin alpha and thymosin beta. They both have slightly different effects of what they do. You can think of thymosin alpha as more of the immune restorer. So it's going to help you to actively be able to fight infections more effectively, as well as restoring the immune system's ability to target the things that don't belong in the system. Thymosin beta has more of immune regulatory capacity. It's helping if you have like an immune or inflammation flare up that's out of control, that's where the thymosin beta would have a better approach at supporting the proper inflammatory response. So that's actually going back like with the BPC. A lot of formulas actually have BPC combined with the thymosin beta as a healthy inflammatory and healing process, because usually when you're trying to heal things, there's inflammation that's kind of undoing some of the healing process. And then if you have the inflammation regulated properly, then it doesn't harm the body, but actually allows it to run its course efficiently all the way through. So then you just heal the things all the way through. So having those combination of these alpha and beta really get the immune system to restore itself. The other interesting thing I didn't bring up with the BPC and also with thymosin beta is they're also antimicrobial peptides too. So BPC has been shown to have antiviral effects and also possibly antibacterial and antifungal. And then thymosin beta also exhibits the similar properties too. So it actually, there's an interesting study, I think, that the thymosin beta outperforms fluconazole as an antifungal agent, just, head to head. So if you use the peptides, you not only get the immune system support, but you have a little direct candida effect in this case.
Okay, fantastic. Everyone needs that.
Yeah.
Need a little help
Since
with their
we're full of,
fungus.
yeah, we're so full of yeast, out of control because of all our
Yes.
toxins, right?
Yeah. So any other peptides that you like?
I also like to use some of the growth hormone releasing peptides. So the most common ones is like somerelin and CJC merelin. They are very helpful just for kind of recreating a fountain of youth for people. So this can be used in your chronic illness patients as well as the anti-aging population. The somerelin and CJC merelin, they're in the class called like growth hormone releasing peptides. So growth hormone, most people know what growth hormone kind of does, but just for those who don't, it's a peptide, or actually it's a hormone. Growth hormone itself is a hormone that usually makes your skin, firm, your muscles dense. It makes you sleep better, just keeps you looking and feeling young, and also makes you feel happy. So typically as you age, your growth hormone declines, and then you get wrinkles and your muscles, atrophy, and then you have weight gain and poor blood sugar control. So the growth hormone releasing peptides can stimulate the body to release more growth hormone compared to just taking growth hormone, and does it safer, so you don't have to worry about any of the overdosing effects. So if you were to use growth hormone peptides, when you stop, your body can still make it. But these growth hormone peptides, they really enhance the youthfulness of your body, which protects your muscles, your brain, your hormones. It really makes everything work as if you're younger. So you feel that way too. Most people, when they start using it, they feel 5 to 10 years younger than they normally are, and they sleep better and they look better.
Yeah, I started taking that as well. So I started taking that maybe about 6 months ago, 4 months ago. Yeah, and I really, really like it. I definitely noticed I'm sleeping better, and people are commenting on my skin that they think my skin looks better and things like that. And I really like it. And it's safer than, I done human growth hormone injections. I did like around like 6 weeks, a million, like maybe like 10 years ago. But the problem is that those can also grow cancer as well. The human growth hormone, it makes anything grow. It's in your body, so you have to, to do some tests before you do that. So there's inherent risks in doing that. So the human growth hormone secretagogues, that's called, right?
Yeah,
It's a lot safer.
Yeah, the effects are a little more straightforward. Like just to give you an example, like the growth hormone itself, the HGH, is like 191 amino acids in sequence. So that's a lot of information, versus some of the growth hormone peptides are probably like 29 peptides or amino acids or less. So then you don't have as much of the over expression of certain things if you were to use them. And then if you stop, like it's not shutting down any processes either. So there's less of that feedback loop compared to traditional hormones.
Yes. Yeah. And so at what age do we kind of really see a decline of the human growth hormone production? Because it's a pretty young age. It's
Right.
so unfair.
Unfortunately, I think it's around like the late 20s, really. Like, so the thing is, the body, like humans are interesting. Like, we reach this peak during puberty, and then around the early 20s, when you probably have the most of everything, all your growth hormone, your stem cells, and everything. And unfortunately, you plateau maybe for a little bit, and really start declining after that. So, that's kind of the way to our bodies work, unfortunately.
Yeah. And then you begin falling apart. But
Yeah,
luckily we can take peptides and keep the
yeah,
fountain of youth going. And so
yeah.
can you take the human growth hormone secretagogues long term? Is it something that you can stay on?
Yes, you can. Although, personally, I recommend if you were to use them cycle in for about 3 to 6 months on and a month or two off, just so your body doesn't become dependent. And also, kind of what can happen sometimes is your body can create antibodies against the peptides, which then will create like a allergic reaction to them. So you're just cycling through that way to you're not letting the body be overly accustomed to them. So it's safe enough to use long term wise. I mean, actually, Summerellin's been around since like the 1970s. So it actually was approved by the FDA for the treatment of growth hormone deficiency. So it has a long safety track record.
Okay, great. And any other ones that you really like? Any other peptides you recommend frequently?
There's a lot more, but I mean the interesting one I found, and this is actually pairs well with the thymus peptides, is the use of epithalin. Epithalin is a pineal peptide. So I've used this personally. When I've used it, it actually kind of helped reset my circadian rhythm. And epithalin's been in research for for quite a while already, but it's been shown to actually lengthen telomeres. So telomeres, if you are in the realm of anti-aging, like those are the end caps on your DNA. So the longer your telomeres are, the more your cells have to divide, so you can divide longer. So that's kind of an interesting thing with the epithalin. But some of the interesting, more recent, like, literature is that it shows epithalin has its effects on minimizing cancer activity by having the ability for your body to repair itself. And then when paired with the thymosin alpha peptides, the thymus peptides, it also reduces the risk for cancers and basically immune aging. So if your immune cells are there for you longer, it's able to help you fight against various infections and just fight things that we're exposed to, like toxins and things. So epithalin is a very interesting peptide for that too. But the other benefits is you do sleep better. I mean, my deep sleep was averaging around like, 50 something minutes. And then after that cycle of epithalin, it, jumped up to an hour and 50 minutes, so it's a huge jump for me. I did other things too, but I think that was a notable difference, after using the epithalin. And the neat thing about that one is you only need to cycle it like once or twice a year, so you don't have to do it every single day like some of the other peptides. So that's the cool thing about that one.
Yeah, I mean, that was just a huge quality of life change by, more than doubling your deep sleep that you're getting.
So it was pretty significant. And then as other peptides, I guess the more popular ones now that we prescribe are like the semaglutide and tirzepatide peptides. Like those are really popular. So
Yeah, those are kind of similar to Ozempic, which is
yeah,
also a peptide
yeah,
as well.
Ozempic and Mounjaro, those are the trade names of those peptides.
Yeah.
But in the past year, they've really gained extreme popularity. So I've used them personally and also prescribed them to patients. And that's probably one of the most popular peptides right now. There's ways to use them safely, so that's why like everybody can get them like from now. Any doctor, you can get more of them online. It's very effective. That's why they are like kind of blockbuster drugs. But when you pair them with like proper diet, nutrition, and also detox protocols, you get much better usage out of them without any side effects. So
Yes.
that's important because the peptides are great and all, they're stimulating the body's functions, but if you are carrying a load of toxins and other infections and you're not properly detoxing, these toxins just end up coming back in, and especially with the weight loss peptides.
Yeah, yeah, that's the, with any weight loss or rapid weight loss, we store toxins in our fat, and you're going to feel terrible if all that stuff just all of a sudden goes into your system and your body has to deal with that. You're not going to feel well.
Yeah, peptides are great, but sometimes it's good to apply with proper like vitamin supplements, nutrition, and food intake. You can't eat crap, unfortunately, as you're using peptides. It just defeats the purpose of some of these things. You'll still get some benefit, but like it's not worth it.
I'm thrilled to announce my new docu-series come out called Heavy. And you can learn more about it at theheavymovie.com and sign up for free. It's a totally free event. And in this landmark series, I interviewed 100 experts on the subject of detoxification, on the subject of toxins, and how these inescapable toxins in our environment are causing our chronic health issues like brain fog, dementia, chronic fatigue, mitochondrial dysfunction, obesity, resistant weight loss, even diabetes. Our diabetes epidemic is caused by toxins. It's not just the food that you're eating. And we also talk about, how toxins interfere in digestion, how toxins are aging you. So many important topics are going to be covered on the Heavy docu-series. So again, go check it out at theheavymovie.com. The semaglutide and some of the other Mounjaro, some of these great for suppressing your appetite and, improving your blood sugar. How do they work exactly in the body? Like what's going on there?
So the semaglutide has the glucagon-like peptide, and then the tirzepatide has the glucagon-like peptide, and it's also known as gastric inhibitory peptide. So it has two peptide functions. The glucagon-like peptide basically works antagonize glucagon. Glucagon typically makes your body raise blood sugar when it senses it needs sugar. So if it antagonizes, you actually get the opposite effect. So you get to lower your overall sugar. The other effects is the GLP-1, as it knows, glucagon-like peptide. It has slows down your gastric emptying, so it makes you fuller longer. And so the most notable effects is you're just not hungry all the time anymore. And it's interesting. So you don't have the cravings for various foods, including even alcohol, which is, a lot of people's vices and why they gain weight. But at the same time it helps to lower your insulin levels, which then lowers your sugars so that you don't have to have sugar floating around as long. And then the weight loss comes with it. What's interesting too is the GLP-1s also have other effects on preserving muscle mass and bone density too. So it works on, there's receptors for that in multiple parts of the body, including the brain. So you get long-term benefits if you're using the GLP-1s. So then the other one, tirzepatide, has the gastric inhibitory peptide, which has very similar effects to the GLP-1s. So it also delays, the gastric emptying. But for what I've experienced with patients is there's little less side effects compared to the GLP-1s alone, which is why most people actually do a little bit better on the Mounjaro or tirzepatide versus semaglutide or Ozempic, in that they have less nausea, they have a little less fatigue that occurs, and also even though they have similar decreased appetite, they just feel a little bit better with the combination of those two peptides. And then the interesting thing is weight loss will occur with both, but the tirzepatide has a little bit more direct effects on your visceral adipose. Like that's the fat in between your organs, which is probably one of the most important ones to not have in terms of, long-term health benefits. So you would want less fat stuck between your organs because all of that can be really pro-inflammatory. So the tirzepatide, the dual peptide, has a better effect on that. So that's why if you had the option to pick one or the other, then I would recommend that one versus the Ozempic or semaglutide.
Yes. And can you take those long term? I mean, you have to cycle off those, correct?
Well, not necessarily. So like that, there's longer term studies coming out. Like the GLP-1s have been around for actually a pretty long time, relatively. They've been discovered for quite some time, and actually they're naturally produced. If you think about it, there's actually various bacteria in the gut that normally make these. So it's something that could be around. It's just in the dosing that we're giving with the semaglutide and tirzepatide, it's higher than physiological dosing. So then there is some issues with longer term use because your body does adapt to it. But some of the more like this anti-aging realm of usage of these peptides is actually just low dosing of these peptides. So you could potentially maintain on a micro dosing of these peptides for a lot of the long-term systemic effects. So you're not going to have like a rapid weight loss as you would if you were on the higher dosing, but you get a lot of those inflammatory protecting, the muscle, protection, bone protection, and still maybe minor bits of weight loss or at least weight control while you're using these low doses of these peptides. So that's interesting. I mean, it's not FDA approved for low dosing. It's really FDA approved for either weight loss or diabetes management. So this is kind of dosing will differ from what you get prescribed for. So, but this is interesting stuff that is available if you have these peptides. So you can prolong the dosing that way and really get the benefits of that for just slowing down your aging process.
Yeah, and that's, I've heard people taking metformin
Yeah.
for anti-aging, which thought was
Yeah.
kind of hilarious, but it lowers your blood sugar, and that's
Right.
contributes
Yeah.
to so many different health issues. So it
Right.
makes
Right.
sense. But it seems like in that same vein, you could do the semaglutide or the Mounjaro as
Yeah.
well, and then the same effect.
Yeah, that's the cool thing about it. So, I mean, it can be cost prohibitive for some people if your insurance doesn't cover it. I mean, that's where the limiting factor can be compared to metformin. Metformin is like pennies on the dollar, for that. But I think the research is coming out. It just shows that there's so much more benefit to that and way less, even less side effects, I would say.
But the metformin can cause fatigue, correct?
Yeah, metformin will deplete your B12, so that's the obvious one. I mean, so if you're not supplementing B12, that's the first thing you should do. But if you dose it properly, I'm not a super big fan of metformin. I found other things that you can do that kind of get the same effects without having to use that. But that's where I prefer like berberine, for example, is one, and then there's actually a new supplement called Fatty 15. Are you familiar with that one?
Yes, yeah, I've heard of that.
That one has some
It's a
really
good
cool.
name.
Yeah, that's a really cool name, but that actually has like a really lot more anti-aging benefits, and it's a naturally occurring fat, so it's nothing bad about it at all. But it has more cardioprotective, metabolic maintenance functions as an actual supplement. So that's a really interesting one.
Okay, nice, nice. And so let's talk about some of the peptide bioregulators. So what is that exactly?
So peptide bioregulators, so they're not technically new. They've been around probably for at least 40 something years. All the research and stuff was done in Russia. So in Russia, they were using these peptide bioregulators on their population, unfortunately, without their consent. But since they were so safe that they were actually showing some of the studies showing like a decreased risk of dying by 30% in certain populations that they were testing on, versus the placebo, which they didn't get anything. So it was very really interesting what they were doing with it. But peptide bioregulators, they're amino acids in a sequence of about four amino acids. So they're really short peptides. They're organ specific, so they actually are geared to go into specific organs and normalize their functions. So as far as peptide bioregulators, they have a name for each type of regulator, but there's about 20 to 21 specific organ peptide bioregulators that are available that have been researched. And so the cool thing about these is since they're so small peptides, they're actually available orally, so you can actually just take them in pill form. They do make them injectable in liquid forms as well too, but they're pretty simple to administer. But the cool thing about those things is also that since they are able to restore your organ functions, you can take them for a cycle, which is about 30 days or so, and then take a break and then revisit it for 10 days every 3 months. And that's when in the literature just showing that that's all you need for the organs to start repairing themselves or restoring their functions. So it's really, really, really neat stuff. You don't have to take them for super long times, and they're oral, so you don't have to worry about injecting yourself in that case. But I've used them for personally about a little over or almost a year, so under a year, on my patients and myself personally. The ones that I've tested out the most would be the thyroid ones. And what's interesting is they can help normalize the thyroid function. I've had patients with, very, very high thyroid antibodies that we've tried to, address, whether there's mold, heavy metals, other toxins, and it got it down to lower levels, but it never fully cleared it out. And then having the patients add in like the bioregulators, it was able to actually lower even further to almost a point where they're pretty normalized, which is really neat. I mean, this is very interesting just to get the body to be able to repair itself with the right, sequence of information. So that is where I think in the next probably year or two, they're going to pop like wildfire. That's where I'm passionate about, like just finding ways to get the body to heal faster. Because people who I see, they've been suffering for years, and they see doctors for mystery illnesses, and you know if an average healthy person, you can give them herbs and supplements and they'll feel better. But some of these patients, they're just so depleted, they need a little more direct approach, and this is one of the ways to do it. And also in the chronic aging population, they need some things to that de-age them, and these are safe, actually some of them naturally occurring too. So it's a great way to get the body to fix itself here.
Yeah, and that provides so much hope because, stem cells can help regenerate you, but it's
Yeah,
just cost prohibitive
yeah,
for
right.
so many people. It's so easy to just take an oral,
Yeah,
amino
supplement. Yeah.
oral peptide
Hmm.
and see incredible results like this.
Yeah, it's amazing stuff. And then the thing is, like, there's 20 different organs, so you can take them and you can cycle different organs, so you repair a few at a time. Usually recommend people to start with like the blood vessel peptide, because your blood vessels are really driving the traffic for nutrients throughout your cells, and those do get influenced by age, stress, toxins, and all these things. So if you have poor blood flow, really your organs can't get the communication that they need. And then you can start adding in the other peptides to start like fixing different organs, whatever you have going on. And if you want to keep your cells from aging, you just kind of cycle overall. You can just cycle through all of the different organs over time to make them as healthy as possible.
Yeah, that's so smart. Such a good idea, and cost effective, and
Yeah,
getting the highest ROI,
yeah,
the
definitely.
highest
Yeah,
return on investment of your,
exactly.
the money you invest, and
Hmm.
easy too. I
Yeah,
like easy.
right, right, right.
Yes, and let's talk about some of the other types of peptides. So there's integrative peptides.
Oh yeah.
Let's discuss those as well.
Okay, sounds good. Yeah. So integrative peptides is it's actually a company that makes oral peptides available for a patient population. They have BPC available. They have thymosin beta, and they have a one called thymogen alpha, which is a fragment of thymosin alpha that's orally available. And they have something called KPV, which is also an immune regulatory peptide. And then they have couple other peptides like cerebral lysin in an oral form as well too. So it's a company that I've used, and the founder is Dr. Kent Holtorf. So he's big into peptides. He's healed himself from like Lyme mold and all these things via peptides when other things, like antibiotics and all those things didn't work. So he's big on the peptide. So I use their products a lot in my practice, and it gives patients a way to help them heal, and it's a little more cost effective versus the injectable ones. So, and since they're oral pills, people have less aversion to taking them compared to the injections. So that's where they, I guess, integrative peptides come into play. But the interesting thing about the integrative peptides is there's a couple of new formulas coming out that integrate both the peptides that we discussed earlier with some of the peptide bioregulators too. So that's where the thymogen alpha actually has fragment of the thymosin alpha peptide, as well as Villion, which is a thymus peptide bioregulator. And there's going to be more coming out too. And then that's the interesting thing about that one. So it's really it's making them more available, the peptide bioregulators coming through.
Okay, fantastic. And yeah, and so can you tell us like what would the website of that company or where we can purchase the peptides from them?
Okay, so yeah, so integrative peptides, their website is, I believe, integrativepeptides.com. Um, I have my practitioner link. I think if you would need a set of account, it's /DR Clement Lee, Clementlee. Um, I'm not 100% sure if non-providers can order it, but if patients or if you guys can try it, I mean, if that link works, then great. If not, if you Google them, you'll probably see other providers out there with these peptides for sale. So they're pretty available, and I vouch for them. They're really good stuff. So that's one option. And then going back to like other peptides, I can share where you can source some of these peptides if that works.
Yeah,
Um,
absolutely. Yeah, well, you can visit you at your office,
yeah, or you can
right?
visit me in office. So I
So
carry
where's
other
your
peptides.
office? Tell us
Yeah,
that.
yeah. So my office is in Pasadena, California. I deal with a lot of interesting things too. So I do a lot of IV therapies on top of the peptides and stem cell exosomes, and then IV laser, which is really, really neat stuff. And then on top of that, I do like the regenerative injections that involve using peptides, but also with prolozone, so ozone, and then PRP and different variations of your blood mixtures. Um, and so if you see me, I can order some of these peptides via some of the suppliers that we have. Um, cost is reasonably there, but there are some other vendors out there which if patients can't quite afford these, they make the peptides in kind of the similar standards as the compounding pharmacies that we would use. So one of them is Limitless Life Nootropics. So the website is spelled that way. And then I have a coupon code available for patients if they are interested in ordering. That would be my name. Actually, no, actually, not my name. It's Optimal 10. So it gives them 10% off that. And then they are creating a sister company, which is going to carry these peptide bioregulators very soon. They actually have them, but the packaging is not done yet. But the website will be Limitless Longevity. I think limitlesslongevity.com. And then the same coupon code, I think Optimal 10 should be able to work once the site is up and running. And then there's another site for all peptide bioregulators as well, and that's Cosmic Nootropics. So they have other very interesting peptides. I haven't used them all yet, but Cosmic Nootropics, I have also my coupon code is Optimal 10. So they have most of the peptide bioregulators. Most of those are imported, so they actually come out of the US. So they're actually from UK, and they do carry other peptides like cerebrolysine and other things that are all mostly nootropic based. So they may not have all the other peptides we discussed earlier, but they do have some very interesting ones for just brain enhancement and actually just getting the brain sharper. So they have some cool stuff there.
Yeah, everyone needs that. Everyone needs help with that.
Yeah, we all
Don't they?
do. Yeah, it doesn't hurt. It doesn't hurt. I mean, the cool thing about these, they actually just make your brain work better without any side effects here.
Yes, yes. And so patients want to work with you. Tell us what your website is again so that they
Okay.
can, I went in and did a
Yeah.
consult with you.
Right.
Super, super happy with the results. I continue to use, a handful of different peptides,
Yeah.
including the BPC 157, and I will continue to. I've just had too many
Right.
benefits.
Yeah. So my website is opthealthwellness.com. I have decent amount of information on the website, and then from that website, there's a phone number and there's a submission form that you can do if you don't want to call. That can basically send an email to us that we can then contact you to set something up. So yeah, that's most direct ways of reaching to schedule appointment. I have Instagram. It's Dr. Clement Lee. I'm not super active on that, though I should be, but I have that available. Eventually, once I get time, I will start putting more content out there, and then eventually a YouTube channel. But right now, it's just I have like my little daughter to take care of, plus the busy practice, so I have to make some time for those things.
Yeah. So anything else you want to tell us about peptides, maybe that we haven't covered?
Along the same lines, I guess, really like anti-aging peptides. There's the use of copper GHK peptide. That one, if people haven't heard about, it's extremely helpful peptide for anti-aging, also immune support. Copper GHK peptide pairs very well with actually BPC and the thymosin beta peptide. But that one is very helpful for connective tissue repair, and shows that it helps with like hair density, skin density, even bone density and and actually blood vessel density too. So everything just gets firmer and tighter. So that's actually a really neat peptide. And then the thing with that one is that one's a small enough peptide molecule that you can use it topically. So you can rub it on your face or your hair. And this is where people have used formulas that you can rub it into your scalp to help grow your hair back, or on your face to prevent wrinkles. And then there's another form of that, which we use if you ever are familiar with LifeWave, which is just for all disclosure, it's a network marketing company, but they make an X39 patch, which is a photo dynamic therapy. So it actually has photons of light in there that have the ability for the body to release copper GHK naturally. So you stick it on the body and it helps the body to release the copper peptide, which then gets all those other benefits I mentioned. So that one's a really interesting one that is available. And that one, since it's topically, you just stick it on your body and you don't have to take any pills. You don't have to inject yourself for that either. So that's a cool one here.
Yeah, I've taken the LifeWave, the X39 before. I like their products for sure.
Yeah. No, it's a great one. I mean, they have other stuff too, but in terms of peptides, that's a more accessible peptide that's out there. So people can just buy that online. I do have my affiliate link to, I believe that one's Dr. Clement here. But anyways, that one is one of the, I guess, more accessible peptides. So you don't have to go through a doctor to order that one. And then I'll bring up KPV. That one's actually my new favorite one. If there are not any favorites, but all favorites. KPV is a fragment of a hormone called melanocyte stimulating hormone. But KPV can be used in treatment of really a lot of our chronic illnesses. It helps to stabilize histamine, which is a big deal for a lot of people when you're dealing with a chronic illness. So histamine is usually that trigger that people have, like allergies and sneezing, and for more of the chronic patients that we see, it can lead to just like irritability, pain, just decreased immune function, and really just toxic feeling overall. And if you're dealing with like chronic, Lyme or mold, people are very familiar with how histamine can make them feel poorly. So the KPV is a peptide that actually stabilizes the histamine pathways, so the body's able to just deal with the histamine more efficiently. But the other thing, it also has its anti-infective pathways too. So if you are using KPV over time, you can be able to fight infections better, which then leads you to be able to typically win these fights in these long-term infection battles. And it pairs well with all the other ones we mentioned, like the thymosin peptides, the BPC. So it's a really neat one. And the cool thing about the KPV is oral. I mean, it doesn't have to be injected. It's 3 amino acids in sequence, so it can be taken orally. There's also like nasal sprays of that, so it's very accessible for people. And so that one's good for a lot of the sensitive patients, because a lot of the other peptides, if you're really, really sensitive, sometimes you can react to those. KPV, I haven't really seen any negative reactions overall, because it really is good for stabilizing the immune response to things.
Okay, fantastic. So that's that's great.
Yeah.
Yeah. Well, Dr. Lee, thank you so much for joining us on the
Sure.
Myers Detox podcast. And I just, I wanted to have you on because you're such a wealth of knowledge and is very experienced using peptides. And I've had such a great experience. I wanted to share it with the audience so they can try them for themselves. So again, check out Dr. Clement Lee at its OPT. Can you say it again?
OPT Health Wellness. So basically optimal health and wellness. That's the name of our clinic. So opthealthwellness.com.
Okay, fantastic.
Yeah, thank you, Wendy. Yeah, I'm so happy to be able to share everything.
Everyone, thanks so much for joining us on the Myers Detox podcast. I'm Dr. Wendy Myers, and you can see, hundreds of free articles, hundreds of free podcasts on myersdetox.com. I just love sharing, all the information you need to help with detoxification and learn about how toxins cause so many of our chronic health issues today. And also we're venturing more into anti-aging to help with that as well, because who doesn't want to look younger and feel younger? So thanks for tuning in, and I'll talk to you guys next week.
The Myers Detox Podcast is created and hosted by Wendy Myers. This podcast is for information purposes only. Statements and views expressed on this podcast are not medical advice. This podcast, including Wendy Myers and the producers, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.